So I've come into a small environment where it appears I've got an unresponsive patient. I've left my equipment outside, but I have brought my PPE in. So I've got my mask, my face mask and my gloves, which I'll put on now before I do my assessment. I'm always going to do my dynamic risk assessment. I like scene, safety, cause, environment, numbers, extra resources. I like to work through that mnemonic. So once I've done my dynamic risk assessment, I'm then going to do my primary survey in the position I find the patient, making sure I'm always looking for my exit route so I know that I can get out. So I can start by talking to my patient. Hello, my name's Jason, I'm a medic, can you hear me? Standard, they respond. I can then ask them to open your eyes, no response. I can then come in closer, but still very defensive. And I can tap them either on the shoulder, or I might just tap them on the leg. But it appears to be unresponsive. So it's not alert, not responding to voice, not responding to pain. I'm going to remove my mask for your benefit on the video. Because they're unresponsive, I'm now going to move on to my ABC to see whether they've got an airway, they're breathing, they've got circulation. I would obviously have my PPE on at this stage. So from here, I can actually do a head tilt chin lift, and I can also do a jaw thrust and come in and assess for breathing. If my patient is breathing, they're still not in a good position, I might have to wait for colleagues to help me to get them out. If they're not breathing, I deem them to be in cardiac arrest. I would like to start CPR as quickly as possible. So I need to get them out of this confined space, this tight area, because I cannot start CPR until I've achieved 360 degrees. So the way in which I'm going to do it is I'm going to put the patient's arms both into the centre of their lap as best as I can. Remember, these would be floppy, and please remember this is a mannequin. I'm then going to push their knees as far away from me as I can, with room allowing, and then I'm going to drop their bottom onto the floor as close to me as possible. So you won't be able to see everything from there. I'm going to block the view. Let me just bring the camera to this angle. So bringing their hands in, popping their hands as best in there, pushing both legs away, trying to sit them up if I can, sitting them up to this position as best as I can. And now I'm going to pull them so their bottom drops onto the floor and they stay nice and close up my back. I can then come on the inside with my hands, ideally get the wrist, but keeping them close to me. I'm still on my knees. I can shuffle around a little bit, and then I'm going to start dragging them out. So as I come around, I'm just creating room, shuffling out. I might then be able to stand, if possible, to actually drag them a little bit further. So from here, I can come onto my knees. They're very close to me in here, and as I come up, I can drag out. So my final position when I had the patient was here, and then when I've got 360 degrees, I can gently lower them down, supporting their head. I'm now into that standard position where I'm in position 1, and I can now go through a better airway assessment. And I'll be going through that in the next video.